This is Trey Lemley, and I'm doing my presentation on speech recognition software for ISC 410. Speech recognition software is an exciting technology with many uses in the healthcare arena. It is constantly evolving and provides major benefits to clinicians and administrators alike. These benefits enhance healthcare quality. In this presentation, I will refer to speech recognition software as SRS. Speech recognition technology was developed in the 1970s, but only in recent years has its use by the medical community become more widespread. At first, SRS was not very reliable nor user-friendly. Through the years, however, the technology and accuracy of SRS have both improved. As a result, more clinicians are using it. SRS is more popular in medical disciplines where using an input device, such as a mouse, keyboard, or touch screen, to prepare a report is not practical. For example, pathologists cannot type on a keyboard when performing an autopsy. Radiologists cannot type on a keyboard to prepare a report while using the computer to examine images. Raymond Kurzweil was an early pioneer in speech recognition technology. He founded Kurzweil Computer Products in 1974. Through numerous mergers and acquisitions, his company became part of Nuance Communications. Today, Nuance Communications is the market leader of SRS in the health industry by virtue of its Dragon Naturally Speaking product line. The speed, efficiency, and accuracy of SRS have all increased due to technological improvements. For instance, word template training is a technological feature that helps SRS recognize a user's speech habits. It creates a voice profile. This increases accuracy. In addition, SRS has regional accent wizards. These help to understand languages, accents, and dialects, for instance, English accents and non-native English accents alike. In addition, SRS has medical vocabularies, which are context-specific. Vocabulary and language models are designed for different medical specialties. These improve accuracy. Also, there is continuous voice recognition. Currently, this is the industry standard. It increases the speed of SRS. It became commercially available in 1998. Before 1998, SRS used discrete voice recognition in which the user had to pause after every word. With regard to the present uses of SRS, it is mainly used in medical transcription. In traditional medical transcription, before the advent of SRS, it was a very time-consuming process. The clinician dictated a note or report. The report would then be transcribed by a medical transcriptionist. Then the clinician would proofread and approve the report. This created a long turnaround time, that is, the delay between the time patients are treated and when their charts are updated. In contrast, SRS immediately translates spoken words into text so reports can be generated quickly. As a result, a reduced turnaround time, often from days to minutes, is a major benefit. Today, SRS can replace human transcription altogether, or through a hybrid model, it can enhance human transcription. SRS translates speech to text, then a human transcriptionist edits the text. Either way, SRS will reduce turnaround times and produce savings in transcription costs. There are many benefits of SRS. One hospital found that SRS resulted in an annual transcription cost savings of $750,000. In another study, SRS improved productivity, reduced staffing needs, and cut report turnaround time by 81%, with the proportion of reports becoming available within 1 hour increasing from 26% to 58%. In a 2009 study, most clinicians felt that SRS allowed them to finish their documentation quicker. thus eliminating time at the end of the day where doctors previously had to finish their documentation duties via the keyboard. Clinicians at a military hospital with the new SRS program concluded that the software was fast and accurate, permitting a patient encounter to be closed the same day. As a result, because of the benefits that SRS brings to medical transcription, clinicians can document real time at the point of care, thus allowing extra time to be spent with patients. In addition, SRS offers administrative benefits as well. SRS can provide automatic transcription, translating the clinician's narrative into a coded output, producing a codified medical record. SRS makes data mining much easier, yielding reports containing information for meaningful use reporting, quality measurement, and electronic health records. CMS core measure abstracts can be completed in a more timely manner. Reimbursements can be maximized when patient records are more accurately coded. SRS makes it possible to retrieve patient information by using a variety of voice prompts, such as retrieve patient chart, or allergies, or diet. Finally, the availability of SRS is a good recruitment tool for physicians, especially for those who want to work with advanced technology. Along with the benefits of SRS, however, there are problems as well. For instance, while some studies estimate the accuracy of voice recognition technology to be as high as 99%, other studies have shown accuracy rates to be lower than human transcription, which is one reason human transcriptionists are still needed. A 2011 study that audited SRS errors in the radiology field noted that transcription errors were one of the major disadvantages of SRS. The authors concluded that SRS, with its benefits and pitfalls, is a double-edged sword. In this study, errors included deletion, substitution of wrong words, reports with confusing and inaccurate sentences. As an illustration, SRS mistook words that sounded alike, for instance, renal and adrenal, lateral and bilateral, hyperintense and hypointense. Clinicians themselves cause errors due to their speech habits, pronunciation, clarity, speed of talking. For example, clinicians in a hurry might speak with fragmented and incomplete sentences. To increase accuracy and reduce errors, users should eliminate disfluencies, such as hesitations, sentence fragments, and interruptions. A transcriptionist can understand disfluencies and then make immediate edits, but SRS cannot. An SRS-generated report with errors can negatively impact patient safety and health, and it can raise the risk of medical malpractice as well. With regard to the future uses of SRS, currently, SRS is used mainly as a data entry tool in the field of medical transcription. However, in the future it might be possible to use SRS as a diagnostic tool to diagnose Parkinson's disease simply by analyzing voice recordings over the telephone in as little as 30 seconds. In addition, SRS will move to a mobile, cloud-based platform, no longer tied to a desktop computer or a computer on wheels, thus providing on-the-go access to clinical data. Further advances in speech intelligence will allow a clinician to accomplish tasks by voice command. For example, to order 2 prescriptions and a blood test, a physician will say, prescribe Captopril 10 milligrams daily, levothyroxine 100 mcgs daily, and order a hemoglobin A1C test. No writing or typing will be required. Intelligent voice solutions and cloud-based medical intelligence knowledge-based systems, such as evidence-based medicine and clinical decision support systems, will be accessible by voice command and will provide decision support to clinicians when analyzing patient medical records. In addition, analytics, alerts, and tracking will be derivable from the narrative dictation of the clinician. In conclusion, as SRS has steadily improved in quality and accuracy over time, it has become more widely used in healthcare. SRS will continue to bring major changes to the healthcare field. Most importantly, SRS will improve and enhance the safety and efficiency of healthcare delivery. As a result, the public will be the ultimate beneficiary of speech recognition software.